Hi, my name is Dr. Jared Clegg. I'm with Advanced Foot and Ankle Center, and I want to talk to you today about one of the most common conditions I see in my office, and that is an ingrown toenail. This is a condition where the nail digs into the side of the flesh of the toe and can get infected and be very painful and very bothersome to patients. I have a lot of patients that spend a lot of time in the bathroom doing bathroom surgery battling this condition, but it's to no avail. It keeps coming back again and again. We here at our office offer a procedure which is a permanent fix. You'll never deal with this again. The neat thing about this procedure is it takes about 10 minutes to do, very minimal pain and quick recovery. In fact, I did my daughter's a few years ago and she actually ran a 5K the very next day. So that's pretty typical of what patients are seeing. So today we have a patient that has an ingrown toenail, and we wanted to show you the actual procedure. For those of you that might be a little queasy, you may want to pause the video and skip this part. But for those of you who like the pimple popper, this will be fun for you. Okay, so here we have an ingrown toenail. You can see there's been some bleeding on the side here. This flesh right here is all puffy and enlarged. I've seen where granulation tissue forms. I've actually seen the nail dive down and poke out the end of the toe before. So these can get very extreme and very painful in people. On the other side here, this is a little bit damaged from some of that bathroom surgery we talked about. So I'm actually going to fix both sides of this nail to try and give him the best looking nail in the long run, and more importantly, the least painful toe for the rest of his life. So we do that, we'll numb the toe up and then do the procedure. So we first start with sterilizing the toe with some betadine. And then once again, probably the worst part of this whole thing is to get it numbed up. So we have a cold spray that we spray on to try and trick the nerves so that you don't feel the needle quite as much. You ready? Here we go. So super cold. 1, 2, 3. There's 4 main nerves to the toe, so we get all of those. And then we'll let that sit for 4 or 5 minutes to get completely numb, and then we'll do the procedure. Okay, so we've now sterilized the skin with the betadine. We have a tourniquet on here so we don't have any bleeding. And then I have tests to make sure things are numb. Does that feel okay?
Yeah.
Okay. Both sides here. And then the root of the nail is clear back underneath the skin. So it's just a lot of people at home are trimming the corners out, and that feels good for a month, and it comes right back. But we need to get clear back down to the root. So we'll do that now. Do the other side, fix the damaged nail over here. I've pulled these out. I've seen them go clear under the skin by 3/4 of an inch, or 1/4 of an inch clear down under the skin. Now if we were just to stop right there, this would come right back. So now we have a chemical we put down that kills the root of the nail. That's what's on the end of these sticks. We'll do this 3 different times for about a minute each. Okay. Rinse this out with some alcohol, get rid of the chemical and sterilize it. tourniquet off. Apply some antibiotic cream. 2 This first day we put a little bigger bandage on, but starting tomorrow morning we simply put a Band-Aid on top of this, and you'll use the Band-Aid for a week to 2 weeks until the area is completely healed up. We have a set of written instructions how to take care of this in the meantime. And I always have patients back 2 weeks later to make sure things are healing as expected. And that's it. You should never have another ingrown toenail. Thank you for watching our video. I hope you've learned a lot about ingrown toenails and their treatments. I hope this will be able to spur you on to having treatment of your own if you have this condition. Please be advised that this is for educational and informational purposes only. For any actual treatment, please seek a qualified physician out.